This morning I woke up and my neck was stiff, and I coughed up a lot of phlegm. It was kind of gross. And I took my temperature and I'm at 101.5. So I thought I'd come in.
There have been a number of actors who've worked as simulated patients in various places, but there hasn't been any real systematic effort that we've seen to see what you gain working with a theater department in medical education. And that was one of the great advantages that the medical partnership has here in Athens. So we really want to empirically prove that, in fact, using these techniques and training the simulated patients with the acting skills really does produce better simulated patients.
Sometimes it's hard to fall asleep because, I don't know, I have a headache or I'm sneezing or something.
So what we have is our collaboration with the theater department provides special training, we think, for our simulated patients. And so what we're trying to do is compare their performances based on the training they got with other groups of simulated patients who are trained in different ways.
But I've been taking some Tylenol and just some over-the-counter flu medicine, and I feel a little better, but it's not going away.
So we've got a range then of 3 different groups that we're testing. So first of all, there's the group in Augusta. The simulated patients there have no recourse to actor training at all. Then we've got our volunteer simulated patients who have no prior acting training at all. And then the third group are actually our acting students who have already taken acting classes and then took a special class focusing specifically on acting in this particular environment. So it's taking everything that they've learned in general and then applying it to this new kind of scene. So our theory is that the best performances should come from the trained actors. The simulated patients, volunteers that we've trained a little bit should be somewhere in the middle, and then the Augusta volunteers should be at the lowest end.
I jog every other day in the mornings. I haven't been, just because it's been hard to kind of breathe.
And I think it has to do with most programs being focused around testing. Their focus on their training is more about evaluating students and more about being consistent from interview to interview. And ours is more about them being reacting naturally in the moment and being authentic, if you will. And that's more of a theater skill set.
As a simulated patient, it was really cool to be able to become the character, Kathy or whatever, and be that person with a flu and be able to interact as that person with those symptoms.
It's definitely good practice. I mean, we have to really get into the practice of learning how to get information out of a patient and to establish a relationship with people. It'll give us a good step up towards our real patient encounters.
The first interview that they did with us, they were very nervous, extremely nervous. But at the end of the year, you saw a student who was much more at ease in talking with those of us who were the simulated volunteers, and you realized that you were a very small part in helping these young people develop the skills that they need to be a very good physician working with people.
So just as in, if you're an astronaut, you don't go out in outer space initially, after reading the instruction manual, you need to have simulated experience as much as possible so that by the time you do the real thing, you know what you expect. And I think it's the same thing with a doctor. Nobody wants to be the first patient. We need them to have experience with patients before they have experience with patients.
No, I don't think I have any questions, but thank you.